Celiac disease is an autoimmune disease that's estimated to affect about 1% of Americans. Celiac disease is triggered by gluten. Gluten is a protein found in wheat, rye, and barley. When people with celiac disease eat gluten, their body mounts an immune response against their GI tract, which can cause lots of symptoms such as diarrhea, gas, bloating, and inflammation. If left untreated, celiac disease can lead to serious complications such as bone loss, infertility, some rare types of bowel cancer, and failure to grow in children.
How do we diagnose celiac disease? We typically start with checking blood tests. We check serologies, so we're trying to detect the antibodies that the body forms against gluten. These are positive in most patients with celiac disease as long as they are exposed to gluten. So it's important to know that if somebody is already on a gluten-free diet, these antibodies may be negative while the patient still has celiac disease. The gold standard for the diagnosis is performing an endoscopy and taking biopsies of the small bowel. So we take small pieces of tissue from the small bowel and examine them under the microscope to see if there is evidence of typical changes of celiac and inflammation caused by the reaction of the immune system to the gluten protein causing damage to the small bowel. How do we treat celiac disease? The only treatment for celiac disease is going on a completely gluten-free diet. Eliminating any exposure to gluten will allow the bowel to heal and the symptoms of celiac disease to resolve.
The healthiest gluten-free diet is made up of foods that are naturally gluten-free. These include fruits, vegetables, beans, legumes, and lots of gluten-free whole grains. You might have heard of some of these already, but just to give you some examples, teff, millet, quinoa, brown rice, wild rice, those are all great gluten-free options. While a gluten-free diet is medically necessary for people with celiac disease, it can sometimes be low in fiber, iron, and B vitamins. Make sure that you include lots of fruits and vegetables and gluten-free whole grains in your diet to make sure that you're getting all the nutrients that you need. Another important thing to remember is that if you have celiac disease, you need to make sure that foods have not been cross-contaminated by gluten in the food preparation process or in storage. For example, oats are naturally gluten-free, but due to manufacturing processes, most oats are contaminated with wheat. If you have celiac disease, be sure to buy certified gluten-free oats only. Gluten can actually be hidden in skincare products and makeup. If you have celiac disease, you need to check your lipstick, foundation, even hand sanitizers and lotions to make sure that there's no gluten ingredients. For example, vitamin E, which is often found in skincare products, sometimes is derived from wheat germ oil and could potentially introduce gluten into your body. Eating out can be tricky if you have celiac disease. The best thing to do is do your research ahead of time, call the restaurant during non-busy hours to find out if they have any gluten-free options, and also ask them if they have methods and procedures in place to avoid cross-contamination. Following a gluten-free diet for life can be a bit overwhelming. Thankfully, today there are a lot more resources for people who need to eat gluten-free. Everything from 100% gluten-free restaurants to blogs and websites dedicated to gluten-free recipes. If you're having a hard time following a gluten-free diet or don't know how to get started, definitely make an appointment to see a registered dietitian.